Hello friends, welcome to Cortex YouTube channel. In this video, I am going to discuss about a case scenario here. The case goes like this: an elderly male who has not seen a doctor in his past 20 years comes to clinic with no specific complaints. On examination, his BP was recorded as 180 by 100 millimeter of mercury in both arms, and there was left ventricular heave and S4 audible S4 present. So the ECG was taken, and what are the findings on ECG and what is the likely etiology they asked. Okay, let us look at the history. He is an elderly man. Okay, and okay, he's not visited any doctor since 20 years. Okay, that's okay. BP, look at the BP here. It's 180 by 100. Obviously it is a hypertension case of hypertension, since he has not visited any doctor since 20 years. So it may be chronic, it may be long lasting. He may be having the underlying hypertension, but he has not diagnosed with hypertension because he has not visited any doctor. So again, presence of LV he suggests there is LV hypertrophy, and S4 means there is atrial click. Okay, let us look at the ECG, what it shows. Okay, assuming that this ECG is taken with a normal standardization, that is 20 paper should run at the rate of 25 per second, and the voltage criteria is 1 millivolt is 10 means 1 millivolt. Okay, these are normal standardization. Let's look at the ECG. When it see, after confirming that it is taken with normal standardization, we have to now know the rhythm of the ECG. So what is the rhythm of the ECG? Normally there is sinus rhythm. Let us look at this rhythm. So rhythm is looked at in the lead number 2. So are you able to identify P waves here? Yes, obviously there are P waves, and there is little morphological change in that. I will explain it later. So these are your P waves, and every P wave is followed by QRS, P wave, QRS, P wave, QRS, and RR interval is relatively fixed, that is regular. So all P waves are looking okay, morphological is same, that means origin is same, SA node, and RR interval is regular, and every P wave is followed by QRS, that means it is normal sinus rhythm. So sinus rhythm, rhythm is sinus. There is normal sinus rhythm. NSR means normal sinus rhythm. Next, what is the rate? Once you diagnose this normal sinus rhythm, rate calculation becomes very easy. It is nothing but 300 divided by number of big boxes between two R waves. So let's calculate the number of boxes between two R waves. Okay, start from here. This is one box, two box, three box, 3.5 box, or okay, it's more than three means the heart rate comes around less than 100. Around 3.5 means okay, let's consider it as 80, 85, 80. Okay, let's take it as 88 beats per minute. Okay, no need to calculate exactly. Okay, 300 by 3.5 somewhat. Now after that we have to calculate axis. For calculation of axis, you need to see lead 1 and lead AVF, because they are perpendicular to each other. So look at the lead 1 here. Lead 1 QRS complex is predominantly upward or predominantly positive. In lead AVF, it is also predominantly positive. That means now both are going up, means normal axis. So axis is normal, that is lying anywhere between 0 to 90 degree. Now let's look at the waves now. Okay, first wave is P wave. This is your 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 P wave. What happened to P wave here? That is slightly prolonged. Look at this P wave from here to here. It is obviously more than 2.5 mm. It is prolonged, and it is having characteristic this bifid pattern, if you are able to appreciate. So okay, this is bifid P wave or M-shaped P wave. Okay, look at this notch. I hope you are appreciating this notch. So look at this notch. Okay, so this characteristic pattern, notched broad P wave, broad notched, looking like M. So M for M for mitral, P mitral. This is P mitral. P mitral suggests left atrial enlargement. There is one more finding which will tell us that there is a left atrial enlargement. That is where you have to look at the V1, lead V1. You have to see the negative component of the lead V1. Look at this. This is P wave. Because normally in lead V1, P wave is biphasic like this. The positive component is because of right atria, negative component is because of left atria. If any pathology related to left atria, which component is affected? Negative component. So enlargement means left negative component will be deepened. So let's look at this. Okay, see here. Negative component is very prominent. Okay, so there is, again, this suggests there is left atrial enlargement. So as of now, there is normal sinus rhythm, normal rate, normal axis. Only abnormality is left atrial enlargement. Now let us look at the QRS waves. QRS, okay. Oh, see here, they are very strikingly tall. What happened here? So lead V1, what happened? There is deep S wave. This is S wave. And lead V6, V5, there are tall R wave. Okay, tall QRS complexes and deep S wave in V1. So this should remind you the Sokolov-Lyon criteria for to diagnose LVH. So there are so many criteria to diagnose LVH, like Sokolov-Lyon criteria, which is famous, and there is Cornell criteria, which I am not going to tell in this video. There is a separate video for that, and LVH in detail I have explained in a separate video, the link of which will be provided in the description. Please go through it. And here let's calculate this. Let's apply this Sokolov-Lyon criteria. This, what it tells is yes, V1 or V2 plus R V5 or V6. If it is more than or equal to 35 mm, this suffice voltage criteria to call it as LVH. This is voltage criteria to call it as LVH or lead AVL. If the R wave amplitude in lead AVL is more than 11 mm, this is again voltage criteria for LVH. Or if any S wave in any plus R wave in any precordial leads, mark here, it is precordial waves, that is your V1 to V6. okay, if it is more than or equal to 45 mm, you can, this is voltage criteria for LVH. This has to be accompanied by, see here it is R, now it is plus. That means both criteria, voltage criteria as well as non-voltage criteria, has to be present to call it as LVH. So what are the non-voltage criteria? You may get LV strain pattern. What does it? LV strain pattern means presence of, see, the leads looking at the left ventricles are lead 1, lead AVL, lead V5 and lead V6. These leads are looking at your LV. So any left ventricular pathology will be represented in these leads. Okay, so any pathology in these leads suggests there is a LV abnormality. Okay, what is this strain pattern? It is ST-T wave changes. What type of ST-T wave changes? There is ST depression. Let me show here. So this ST depression is not horizontal depression. It is not upsloping. It is downsloping ST depression. It was normally, it was supposed to be like this, but it is now, it has become like this. Okay, ST sloping downwards, with T wave inversion. So this is nothing but strain pattern. If it is seen in these leads, that is called as LV strain. If it is seen in V1 to V3, it's called as RV strain. It is as simple as that. Okay, there is LV strain and or there is prolonged QRS peak. What does it prolonged QRS peak means? See, because there is LV hypertrophy, more muscle mass means there is some amount of delay in depolarizing all the muscle tissue. That is represented by prolonged R wave peak. That is, it is because of intraventricular delay, conduction delay. Intraventricular conduction delay, it's called as simply known as IVCD. So why there is? Because of muscle mass, more conduction delay. So how it looks? See, normally this is the time taken to become the peak, okay, this duration, but because of LV hypertrophy there is slight prolongation of peak. Normally it's supposed to come here, but it has come delay, there is a delay. So this is because of intraventricular conduction delay, because of hypertrophy, more muscle mass. So I forgot to mention here, strain is because of strain is nothing but ischemic pattern. So there is subendocardial, this tells there is subendocardial ischemia. What happens whenever there is hypertrophy? The endocardium, obviously in normal heart also, endocardium is the last one to get blood supply. So first there will okay, in hypertrophy what happens, there is because of contraction and because of hypertrophy, your subendocardium gets less blood, so there will be subendocardial ischemia, that is represented as strain pattern in ECG. Okay, so let's look at this ECG, what it tells. Okay, S wave, how much is the amplitude of S wave in this lead V1? 1 box, 2 box, 3 box, 4 box. 4 box means 4 into 5, 20. This is 20 mm. Okay, what is the R wave amplitude in V6? 1 box, 2 box, 3 box, 5, sorry, 4, 5. So 30. Sorry, here it is 25. 25 plus 20, it is 45 mm, which is more. So one is voltage criteria, one voltage criteria is satisfied. Next non-voltage criteria is there is look at the LV strain. I told you to look at the lead 1, AVL, V5 and V6. Look at the ST T wave. Okay, there is ST, it's not depressed, but flattening is there. Here also it is flattening, but look at this V5 and V6. Okay, there is characteristic ST sloping downward with T wave inversion, ST sloping downward with T wave inversion. Okay, so this, there is LV strain. Okay, there is LV strain, and with along with this voltage criteria, that is 45 mm with LV strain, we can call it as LVH. So ECG is also telling that there is this elderly male has LVH, left ventricular hypertrophy. So there are so many causes for left ventricular hypertrophy, like hypertrophic cardiomyopathy or aortic stenosis or coarctation of aorta, or there are so many causes. Uncontrolled chronic hypertension, acromegaly, pheochromocytoma, so many conditions are there. Okay, but in this elderly man, what is the likely cause for LVH? What can explain LVH in this elderly male? See, he has not visited a doctor since last 20 years. That means he may be suffering from, he may be suffering from a hypertension, but he didn't get diagnosed. So it could be because of uncontrolled chronic hypertension. In this, because in this OPD sitting, he is having 180/100. So we can diagnose him as uncontrolled hypertension, and LVH is because of uncontrolled chronic hypertension. Okay, this is it. Treatment aspect I am not going to deal in this video, it takes a long time. I hope you found something useful in this video. If so, please like, share and subscribe, and feel free to comment your opinion, answers, queries, anything. I would be happy to address them. Thank you.